Have you ever felt something just off with your body? Low energy, stress, or subtle changes you ignore? Sometimes these signs might reveal certain hidden inner issues most men don't talk about. Hi, I'm Dr. Priyank Kothari. I'm an andrologist and men's health expert, and today we are going to dive deep into certain things which men actually ignore or avoid discussing. We're going to talk about erectile dysfunction. It is more common than you think, and it does not only affect your physical health, but it also affects your mental health, relationships, and confidence. Let's start by understanding what this condition actually is and why it happens. ED happens when men are actually unable to either achieve a good enough erection or a hard erection to have intercourse, or they achieve an erection but are not able to complete intercourse because they are not able to sometimes sustain this erection. And this happens, or when we say it is erectile dysfunction, we can actually label this or decide that this is a problem when it happens recurrently and it is happening over the past 3 to 6 months and not only a single episode, which can actually just be an aberration. Because occasional difficulties are common. You could be stressed out, you could be tired, or you could not be in the mood, and therefore on one occasion you might not be able to perform or you might not get an erection. But when this is recurrent, that is when we can label it as ED. Many men think that erectile dysfunction is only a disease, or ED can happen only in older ages or maybe above 50 years. But that is not the case. ED can happen in 20s, 30s, 40s, and obviously in 50s. It can happen at any age and it can happen to any individual. In today's era, with the pandemic of obesity and urbanization, 1 in 5 men about 35 years of age have actually been seen of experiencing ED, which they may or may not report, but that is what the statistics say. Now we know what ED is and when it can happen. So the next question is, why does it happen? Erectile dysfunction or ED can be a combination of both physical and psychological causes. Physical, or sometimes we can call it reversible, causes of ED can be blood pressure, diabetes, low testosterone, some form of nerve damage, some form of severe infection, heart disease, and also lifestyle factors such as smoking, alcohol, obesity, and a very poor diet. Psychological causes include stress, anxiety, relationship issues, and depression, which is becoming more and more common these days. Often both types interact. For example, if 1 or 2 episodes of ED because of certain stressful situations occur, it affects your mind, and next time actually it becomes more of a psychological problem. Even though physically you might be able to achieve an erection, the anxiety of the situation actually can cause ED. And yes, what is more important, although ED can be psychological in younger age group, with the recent times ED can sometimes be a subtle warning that the vascular system of the body is getting affected, and it can be a subtle warning of future heart disease and even future stroke. And therefore don't ignore the symptoms, and it's very important to get oneself checked. So now that we understand the causes of ED, how do doctors go about assessing or understanding the cause in a particular patient? Diagnosis starts with a simple checkup and a few questions about your health or about your sexual experiences. So what are these questions the doctor would actually ask and understand what the problem is? A sexual history, which would include about your erections during masturbation or erections with a particular partner or a particular situations, and the occasions where you are not able to successfully have intercourse. It will also include asking about any medications which you take regularly which can affect your erections, or other lifestyle factors such as smoking, alcohol, sleep patterns, or occupational related stress is what the doctor would divulge into while taking a history to understand the problem. A basic physical examination would follow a history wherein the elasticity or the blood flow to the penis can be assessed by a simple examination along with the testicular size, and if required, few blood tests are run which would include your blood sugars, lipid profile, homocysteine, cholesterol, and vitamin B12 and D3, which is becoming more deficient in vegetarian population. And after this, a doctor can come to a conclusion of whether there are any reversible factors, and then therefore can treat these factors. All this helps us to pinpoint the cause and then guide treatment in the right direction. Once we know the cause, the treatment becomes much easier and directed, and we can get better results. I often hear this, all this is in my head. I am too young to be suffering from this problem of erectile dysfunction. I am just 20-25. This is not a physical problem, it's all in the head. Is this always true? The answer is no. ED is not always just psychological, and there can be physical causes which I already mentioned, like blood pressure, diabetes, lifestyle change, lifestyle related issues leading to vasculopathies and nerve damage, and therefore it is not always psychological. A lot of people think that erectile dysfunction happens only in older men, but it is also common in 20s, 30s and 40s. Sedentary lifestyle involving no physical physical activity. Also, smoking and alcohol as habits can affect erectile function in a younger population. And often the idea with patients approaching is medication the only solution? No, so that is not the truth. Only medication is not the solution. Solution here is to understand where the problem is arising from. If it is diabetes, controlling the sugars, having a very healthy lifestyle, having a strict directed diet, and regular exercise can go a long way. So these are erectile dysfunction or ED, and it's not always the medications that are required. Of course, few medications in the beginning to boost the confidence can be required, but that is only for the transient time in most of the patients who are suffering from mild erectile dysfunction, which is the most common form. So a combined approach of lifestyle changes and medications along with some amount of counseling from the right expert can actually go a long way in treating or the ED or nipping it in the bud. Actually, ED is a lifestyle disorder and it is being a sign of greater damage in the future. It is beyond sex. ED is not just a sexual issue, it affects mental health and fertility as well. Fertility, how you may say, if there is erectile dysfunction which limits intercourse or limits chances of intercourse during the fertile period, it limits the chances of conception therefore, and therefore a lack of sexual activity or inability to actually attain erection and have regular sex can mentally affect the male, because it can become an embarrassing situation and it can lead to a loss of confidence and it can lead to relationship conflicts, leading to a severe effect on mental health. Physical health, mental well-being and sexual performance are all interlinked, and sexual dysfunction and erectile dysfunction can be a sign of something much larger or much bigger. So what do you actually do about it? What changes can you make in your life so that you can prevent ED, or if it's in the early stage you can reverse it? Here's what you can do. Lifestyle changes would be exercise. Regular exercise, I would suggest 45 minutes. A combination of cardio and weight training would be great. A healthy diet which would include fruits, salads and a balance of fats, carbohydrates and proteins as required and as advised. 8 hours of sleep, uninterrupted sleep with a regular circadian rhythm, and some amount of stress management in life such as yoga or certain mindfulness activities can also help. This is the first step. What else can we do? A regular medical evaluation and checkup. We have to rule out common dysfunctions or diseases which can actually not only affect erection but other bodily organs. A regular checkup for blood pressure, diabetes, probable lipid profile, and a simple checkup should be done so that we can pick up something at the earliest and therefore prevent irreversible damage or prevent further progression. Next is therapy or counseling. If you are facing some amount of stress, some amount of relationship issues or anxiety related to work or related to relationship or related to family members, it's very important to get counseling, get therapy so that a small problem doesn't become a bigger one. The fourth thing is medications or devices. Now what actually one should not do. Medication and devices should be taken or used only under supervision of a doctor. Taking over-the-counter medication, sometimes one might not be aware of the side effects or one might actually become habituated if not taken in the right manner, and therefore medications and devices to be taken if you are facing an issue under a doctor's supervision only. Remember, ED is a signal and not a life sentence, and early action can improve your health, confidence and quality of life. Taking the first step and talking to the doctor is the key. If you found this episode helpful, share it with someone who might need it or might benefit, and subscribe for further men's health related insights.